think, particularly in the age in which we find ourselves now, in the particular political climate, it's very clear that health is the outcome of many, many things, and we know about the wider determinants of health, and we know that many people's poor health is actually related to as much as what's going on around them as what's going on within their body. And certainly half of the people we see, whether they have diabetes, COPD or anxiety, depression, much of their health problems comes from those causes that the tablet won't solve. And for years it's been incredibly frustrating, people coming along telling you their distress, their life problems, their housing problems, their relationship problems, and thinking, what can I do? I can listen, I can give you an antidepressant, which is really not going to do very much, and we really need to be not prescribing so many antidepressants. But if I can listen and understand their problems and the range of problems, and then say, do you know what? If you met my friend Mark, he works in this surgery, come and spend an hour with him. He can understand your problems and start to help you solve them or work out how to navigate the chaos of your life, and being able just to offer something that is really going to help that person relieves an awful lot of frustration, but also makes me think, yes, that person's actually getting what they really need now. And we have seen people's physical health improve. You know, diabetes results have got much better. People with COPD are doing more exercise, pulmonary rehab, they're getting physically better. And the massive improvement in people with poor mental health, with anxiety, who are being helped to get out, to get to the recovery college, to understand perhaps some of the reasons behind the way they're feeling. And I think it's made an enormous difference, and I think that's only going to go from strength to strength. Bringing those prescribers into the general practice team or even within their walls can very much help people acknowledge that the social prescriber is part of that health team. So I would suggest possibly going out, seeing what your community assets are, finding if this is already going on, and then seeing if you can work with those community organisations to perhaps second or subcontract or get somebody to come and work within your team who already has those skills and knowledge of your community. A really valuable first step is trying to spread that word and try and help other practitioners, whether they be nurse practitioners, practice nurses, GPs, to understand the value the social prescriber adds, because once everybody's speaking the same message, the population will understand that much better and the whole thing works better.